The Surgeon General has actually declared loneliness an epidemic in our country. We've seen loneliness increasing over the past several years, particularly in the context of the COVID-19 pandemic. We've definitely seen loneliness, especially in populations that are maybe older or have a little bit of trouble, accessing kind of social networks and things like that.
I think one of the data points that they often refer to is that adults are spending an average of 24 hours alone per month more than they were in previous decades. And that's been increasing over the last 2 decades. And that data comes from pre-COVID times. So we can assume that it's become even worse.
So this is not something that just appeared out of nowhere. People have been feeling it for a long time, especially as communities and those opportunities for connection become less and less, whether that's a faith-based community, service organizations. Opportunities to connect with one another are diminishing and decreasing really quickly.
We conducted our adult behavioral health survey of the kind of Winnebago, Calumet, Outagamie County region and found, definitely some disparities in some of these mental health and loneliness related outcomes in Winnebago County. We've also seen in the county health rankings that comes out from the population health folks at UW-Madison, Winnebago County having one of the highest rates of folks that experience poor mental health days as compared with other counties in Wisconsin.
In Winnebago County, I think some of the most concerning data that we're seeing is in our most recent 2023 survey, 75% of our high school students do not feel like they are getting their emotional needs met when they have those emotional needs.
There was a report by U.S. Surgeon General Vivek Murthy that talked about both the physical, social, emotional effects of social isolation and loneliness and compared loneliness to being as detrimental to our health as smoking 15 cigarettes a day, which we all know, right? Like that's going to cause a lot of health effects, but social isolation and loneliness really can have huge physical effects.
Social isolation impacts all pieces of the human experience: physical health, cardiovascular disease, stroke, anxiety, depression, thoughts of suicide. All of those are very prevalent in loneliness.
So the costs on our healthcare system increase when we don't have socially connected communities.
When we talk about loneliness, we don't say it's an individual failing. To say like, oh, just try harder, like make more connections. It's a community issue. And some of the way we're feeling is rooted in community design. Some of it is the kind of changing nature of our life.
So looking at it from that basic needs lens, we are really trying to think of how we can build supports around people so they have the time and space and capacity to be supported.
As we think about sharing emotion openly with other people, finding those places where you can do that has become increasingly difficult. Once you make that connection, there is a relaxing of the body that happens where the connection is deep and meaningful.
Community living room is a non-clinical, person-centered space where folks can find connection. The intention with the space was to break down all of the barriers that folks usually find to seeking support. So community living room, you don't have to have an appointment, you don't have to fill out any forms, there's no insurance, there's no requirement of a certain identity or diagnosis, just listening.
Rather than sort of expecting folks to reach out to seek that support, why don't we bring living rooms to them? And again, offer that connection as prevention. And that's really where the community living room sort of concept and idea was born, was sort of out of that desire and that recognition that we need these sort of informal, peer-supported, peer-based spaces where people can come and have a conversation and connect and sort of talk about what's on their mind that day and be heard and listened to by a person that has received training in emotional CPR.
So that's part of the training that we do for the listeners in the living room. And the opportunity when someone shares, there are, 4 things that we do when a person shares in the living room. We see them, we hear them, we value them as a human being, and then we believe them. And I think that's the key component, is we don't judge, assess, fix, make a determination on whether what they're sharing is logical. It's about the emotional connection and believing what people are sharing.
Community living room listener is someone who has had the good fortune to be trained in emotional CPR and learned to listen.
Community living room listeners all receive training in emotional CPR, which is a public health community education program that teaches folks how to really listen.
I hesitate to say training because emotional CPR is a practice, and it's very different than the ways that we learn to communicate with one another. Embodying the tools of listening, a lot of it is the inner work of recognizing the blocks that we have to fully listening, understanding, and believing what another person is sharing with us.
So this really helped me to understand that the listening part is letting them talk and recognize their feelings and perhaps let them come around to how to solve something or how to work toward it on their own. It sounds like an affirmation. It sounds like something we all know. And maybe we do. I knew it, but I didn't do it. And it's a huge difference. It's kind of a magic thing when it happens.
The connections that happen in the community living room are profound. They are magical. It is a moment where you get to witness another person being seen and heard and valued just as they are. And sometimes that's in crisis. Sometimes that's in joy and celebration. Sometimes that's in frustration or anger. And that witnessing of people right where they're at is magical.
When you come to our community living room, you come in and we always invite you to take a beverage or a snack to make yourself comfortable. We have couches, we have tables. So sometimes in community living room, we're just sitting. Sometimes we're laughing and sometimes we're crying together. Sometimes we're playing games or coloring or doing karaoke. Whatever folks want to do for connection, we offer that.
We actually hosted a total of 18 pop-up community living rooms in the community that were really well received, that were well attended by folks from all kinds of walks of life. And now actually there is a brick and mortar permanent location that's been established in Outagamie County for community living room.
The community living rooms were really designed to go back to the same place over and over, to give new people, but also the same people, some opportunities to keep coming back. And I think that the growth that each of those spaces experienced in the people that came back or the people that started and continued to come back was also some really great experiences to watch.
We're very thoughtful about how we measure success. So when we give data about the number of people that come, and that's important. But more important than that is kind of the qualitative data and really how this is impacting folks. And we see relationships that we've built from the grant with folks who continue to stay connected and have found community through this work.
The AHW funding for this project was pivotal in being able to bring the community living rooms here. It's not something that we would have been able to do without the grant opportunity.
The AHW funding provided a tremendous boost for this work to seed this work in community. This work is deeply grounded in relationship building, and that takes a lot of time. That's not something that you can just, right, like magically, here it is. It takes time, it takes energy, it takes trust. And so the AHW funding allowed us to build that trust.
The community living room project here in Winnebago County was a really resounding success. And we heard a lot of positive feedback from the folks that attended the community living rooms, as well as the folks that attended the eCPR. So we feel like we have a really good foundation built on our community living rooms and the need here in the community. So we're actively seeking out additional opportunities to expand and sustain our community living rooms here.
There is this connection that lasts well beyond the specific community living room time, watching the connections that happen with the people that come into the space, the friendships that carry beyond the living room. That's when I think of why this was built. That was it. There's this ripple impact of connection